Hi everybody, how y'all doing?
And on you?
All right, pretty good, pretty good. Just so you know, I'm Dr. Hodge, Dr. J. Emmanuel Hodge. All right, I am a holistic health pain specialist and integrative medicine physician, among other things. All right, and today, Aria has asked me to give you guys a presentation on what I call POPA. All right, perspectives on pain alleviation. All right. Um,
Thank you.
oftentimes we're in pain. As we get older, we find we hold on to these pains a little longer than we would like. Is that correct?
Yes.
All right, that happens oftentimes. And so one of the things that we forget as we're moving through life, accomplishing our goals, teaching others, helping others, doing for others, is we forget sometimes how to care for ourselves, all right? And how to deal with different challenges that present themselves in the body, all right? Now, the body's the same for everyone, just how it functions and where it's caught up might be different, all right? But the whole pattern of circulation and everything, most of us have one head, all right? A torso, arms, and legs, all right? It's the same for all of us, and all of us utilize breath to survive. Have you ever seen anybody just walk around not breathing at all? No. In the grave, right. But they're not walking around, all right? You might see shadows of the beyond, but ultimately, to be on this plane, to be on this earth, what do we have to do to sustain our life at minimum?
We must breathe.
We have to breathe, all right? Now, in perspectives of pain alleviation, i.e. POPA, all right, the understanding is how to utilize your breath, all right? And how to have your breath aid you in the alleviation of pain by accompanying other sources as well, okay? So, learning how to use our breath within pain means, one, we have to identify that we're in pain, right? Okay? And in this program, the basis of this program is understanding in all that we do, if we can add action, positioning, movement, and hydration, all right, into whatever challenge presents itself to the body or in our functionality, all right? When we're functioning properly, we're happy, we're just go-getting, we're doing, we end up overdoing it sometimes, right? Because we feel good for the first time, all right? And then other times, we're in a state where we can't move. We're just, it's too painful to move. I'm gonna just wait till it passes. Isn't that how we kind of do it sometimes? Yes? All right, so in this, what are the 5 things I said we're going to use before I jump into them?
Movement.
Movement is 1.
Positioning.
Positioning is 2.
Breathing.
Breath. And with the A, right? It's called action. The first thing we need to do is take action. If we only think about things, nothing changes, right? It is when we take the action to do something about it, all right, that it changes. Am I correct or am I correct?
Correct.
Okay? So if we're in pain, whatever the pain is, the first thing we got to say, okay, I got to take an action. What's the action that I need to take? All right? Now, the action you need to take will require you to go into a particular position that aids that particular challenge. All right? Now, on our own, when we have a pain challenge, what's the first thing instinctively that you do when you feel pain? What do you think? Right? Exactly. You say ow, right? But what do? What happens to that? You touch that area. All right? So if you're walking and you take a step and you feel something in your back, doesn't your hand go right there immediately and go, ah, ow? Especially when it's almost paralyzing to move, where you feel that sensation. The design of our body, our being, and our mentality within dealing with this is fortuitous, all right? Because automatically we do certain things that we don't know we're supposed to do, all right? Now, first, that action is identifying where that problem is, all right? And I see a lot of you have back pain, lower back pain, right? Somewhere? Yeah? No?
Yeah.
I see one. No? No lower back?
My pain is right here.
2 hips. All right.
And there's another hip over here.
Okay. So we'll go through individually for applying this with you individually. But first things first, when dealing with pain, the first thing we want to do, most times our mind tells us, ow, don't touch it, right? But really, that ow means touch it. All right? So we got to switch the way we think of things. All right? Now, what's the second thing I said? Action, then breath. All right? Action, breath, positioning, movement, and hydration. We're going to go in that order. First thing, action, identify the pain. Second thing, breathe through the pain. Breathe by exciting the pain. Okay? Now, what I mean by breathing through the pain and breathing to excite the pain. See, the action is identifying the pain, all right? We haven't put ourselves in a position yet because this happened to me once. I was in the kitchen, all right? And I opened the refrigerator and something fell out. And I went to pick it up, and all of a sudden, I couldn't move. I had this searing pain that just ran up from my glutes to my back. I couldn't move. I just had to hold on. Okay? Now, the first thing with this process of POPA I said to do is breathe, right? Now, when we think of breath, all right, there are different breath sounds, but the sound that I'm helping you to utilize for 99% of your challenges is a sound. All right, let me hear you guys. Very good. And when we're doing anything, we want to do it 3 times. All right, for each thing we do, how many times do we need to do it? 3 times. Our first time, this is our skepticism, this is our doubt, this is our fear saying, oh, I don't know if I could do this. All right, that's our first breath. Our second breath is our acknowledgement of, okay, I'm steadying myself. This might be able to work, I don't know. And our third breath is our acceptance. It's our, yes, okay, I feel a shift. Something is changing. Now, our breath can alleviate our pain and eliminate it completely at times. But moreover, when we are specifically in especially a paralyzing pain, all right, we have to take our time. So this 3 becomes 3 to 9 times. Maximum 9, minimum 3, maximum
9.
All right, now the reason for this is because you're going to see the shift gradually within your challenge, whatever the challenge is. All right, now because we want to make sure that we're functional. So the breath that I would like you to use is what? Right. This breath, an exaggerated release. All right? Not forced. All right? But an exaggerated release. This means you're not pushing the breath. You are releasing the breath in a space of surrender, acceptance of said pain, whatever it is. All right, so it becomes a release rather than a force. Do we understand the difference? 3-second breath. All right. Now, the numbers you're going to remember is 3 to 9. What's how many? 3 to 9. Within any aspect of this, if you're breathing, it's within 3. All right, and it is 3 as well, times that you're doing it. All right, if you're moving something, whatever it is, wherever the pain is, you're doing it with the breath. 3 times to how many? 3 to 9 times. All right, and are you doing it in tandem with the movement, or are you just breathing and then moving? Breathe in tandem to whatever the movement is that excites the pain. So remember earlier where I said you're breathing into the pain, you're actually exciting the pain. So the movement allows you to excite the area that you're focusing on. Because what did you do when you first felt it? You touched that area. Now, in the touching of the area, you're holding, reassuring, and stabilizing. All right? So if you're holding, let's say it's a shoulder pain. All right? You hold the area, you feel it. All right? Squeeze lightly into the area if that causes pain. If it doesn't, if the movement is what causes pain, then that's where we're going to go in the direction of pain. Wherever the direction is that causes pain, we're going to exhale into that direction. And so we're going to go breathe in and then into that pain. Shake it out. How many times? 3 times. So then again, breathe in. Remember, our breath with intention, and this is why I say breathe in slowly, and we're holding it for that 3 seconds. All right? And then exhaling with the movement, because our intention is allowing the focus that we're moving into to be addressed specifically. Okay? So we're exhaling in that movement 3 times, all right? If it's a shoulder pain. If it's a hand pain, find where the pain is, move that area or squeeze that area 3 times. With what? With what?
Intention with breath.
With your breath, all right? So find your pain. Each one of you have different pain. Find your pain, all right? And you're gonna put your hand on it. For you, for the knee, a little something different. I'm just gonna have you kind of rub in a circle, all right? Did you ever have knee replacement?
Just the hips.
Just the hips?
Just after surgery.
Okay, so with the hips, in that particular type of surgery, a balancing needs to happen, and I want you to participate in that process when we do that part. It'll help, fixing this will help this. Because they've been replaced here, the muscles grew time to kind of protect you and hold you. And so it feels tight and painful when you move at times, all right? Because those areas need to be released, and it's trying to hold you, because when we have those type of surgeries or when we have those type of physical pains, our ilium, all right, the ilium is what? This is our hip, this whole hip, pelvis, everything, right? Sacrum, etc. So this area for us can move like this, 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 or this. That's a lot of different directions, right? Now, within pain alleviation, it isn't about necessarily identifying which direction it is when we balance ourselves anteriorly. All right? So, and I'll get into that process of alleviating that particular challenge at the latter part of this discussion. All right? But the principles that I'm sharing apply the same, but remember, different pains require different positioning, okay? And I'm only going to show you a few different positionings today that aid in pain alleviation, but they apply in every aspect of pain. Yes.
So for my hips,
A little louder, I can't hear
for
you.
my back area,
Uh-huh.
it's not like I'm bending it. Do I put my hand on it and breathe?
For right
Because,
now,
you know, people that have a hand ache, you know, you can put your hand on your.
right.
know,
For the back, if you can reach the pain, however you can reach the pain, touch the pain. If you can put your palm on the pain, even better. All right? Especially when it's a center body challenge, putting your full palm on there works. Now, when we have joint issues, much like you with the knees and the hips, as I said, there usually a shift in the ilium that causes tightening on the lateral, collateral ligaments on the side, which causes a pinching, which causes some compression, which causes a wearing of the meniscus, all right? And in some cases, that shift can cause a tear in the ACL, all right, which is at the front of the knee, anterior cruciate ligament, okay? So when it comes to joints, same process, just tweaked slightly, all right? Because those need opening because of the compression that they're in or the shift that's causing a pinch on maybe a particular nerve, or maybe it's the muscle twisted and inflamed, or maybe it's a buildup of hyaluronic acid and fluid. There are a lot of different components to what can cause the pain, but the challenge is alleviated in the same way. Why? Because what's our life-given? In order to be alive, what do you got to do?
Breathe.
You got to breathe. So we got to use our breath to work for us. All right? So I said action is associating, finding the pain. Breath, breathing with the movement. Movement, moving and exhaling to excite the pain. All right? And the position, depending on the challenge, is the direction you're going to be moving it. First, you isolate it in the opposite direction of what causes the pain. Okay?
Question.
Yes.
How much of the individual passion
How much of the individual's passion or heart?
to say, every time I pray, I don't necessarily have the
Right.
same. Yeah,
I will say it this way. Depth of passion increases.
What kind of depth?
Depth of passion. Because notice I stated earlier, intentful action. Intentful breath, intentional movement. Now, I don't want you to be passionate to the point where you're controlling, which means tightening, restricting, and forcing. This isn't about force, okay? Passion in terms of having the willingness to place that desire in your intention and exhale into that movement, yes, but not in the aspect of control. Because sometimes when we seize passion, you notice I got tight, right? Now, 9 out of 10 out of our problems is because of that natural tension we walk around in. All of us walk on this planet dealing with a lot of interesting challenges that come our way simply because of how we look. Which means when we go out into the world, we put on our own little force field. And that force field is our protective barrier. We're walking around like, sup, and just moving. But that tension, it stays with us, all right? Throughout and consistent. And because of that tension's consistency and what we consume to aid in the dysfunctions that are developing within us, all right? That tension can be tantamount to holding your breath. You ever notice sometimes you'll hold your breath and you don't know you're holding your breath until you gasp for air for a moment, like, oh, wait a minute. Has that ever happened to any of you? All right? So those are all forms of holding tension. And of course, our bodies are filled with acidities. There's acidity to help us. All right, this is our white blood cells and our platelets. They're very acidic in their actions and movement. All right, our red blood cells need acidity with the propulsion to aid our capillary exchange so that our body receives the nutrients that we require. However, when we're in an imbalance of acidity versus alkalinity, all right, that acidity creates buildup. That buildup represents itself as tension, tightness, swelling, inflammation. All right, and accumulation. All of these are forms of tension that we're holding. All right, and because our bodies are filled with what latest is say 80% water is our body, right? And so because our body is filled with 80% water and our mind encodes water, whatever we think becomes what we feel, what we live, what we experience, all right? And the functionality of our vessel, all right, relies on circulation of said fluids within the body, all right? When our fluids are interrupted through this inflammation or accumulation or anything along those lines, then it starts to affect our heart, all right, meaning our passion, our ability to function and do. It starts to affect our spleen, meaning how our bodies absorb, transport, and transform what we consume in our body, all right? And it also affects the way we think, because when our heart and our spleen is interrupted, our stomach in how we receive, our spleen in how we transport and transform it to work for us, all right? And our heart affects how we think about different things and the passion in which we put into whatever it is we're doing, right? So you notice those are just specific imbalances, and those are just imbalances in the blood. So imagine when that translates to the ligaments, the tendons, the vessels, all right? The healing, you know, it creates different challenges. Another sign, varicosity, varicose veins. This is a spleen imbalance because stuff isn't holding in the vein, okay? And so circulation is interrupted. Accumulation is onset. Accumulation causes rupture. You see what I'm saying? So these are different aspects of what is being affected on a deeper part of a simple pain. Because depending on the pain and how long and how hard and how much, it's going to affect how you're thinking. It's going to affect how you're doing and how you work with that pain. I was speaking to someone earlier and they were saying, oh yeah, I do Aleve and Tylenol and all of these things for my pain, right? But it just wears off and it feels like it's getting worse. Now, the one thing we don't realize is these things, though they seem like they help, and they are necessary at times for certain things like really strong headaches and stuff along those lines, or if you have a bacterial infection or something along those lines, it can help with those things. However, they mask the challenge. All they're simply doing is thinning your blood so as to lower your body's ability, one, to heal. Not that that's its intent, that's just simply a reaction. It lowers it simply because we need our body to do what in order for ourselves to heal? Move, circulation. Everything has to be able to flow. All right? We need to be able to reach, extend, come out, lift, etc. That can't happen when we have hindrance, blockage, or rupture in a specific area. All right? So these things have to be addressed. Now, in our bodies, we have our red blood cells, our white blood cells, our platelets, all right, enzymes, etc. All right. What is the one thing you haven't heard me say yet? Water, hydration. Okay. Now, you know, I mentioned about the alkalinity and acidity in the body. Unfortunately, we live in an existence presently where we have about 70% acidity going on in our bodies, which is causing havoc on our systems. All right, it's contributing to things like cancer. It's contributing to a lot of these flus and phlegms and buildup in the body, etc. All right, now, when we shift that alkalinity, and because we gradually became highly acidic, we have to work ourselves to becoming more alkaline. All right. Now, that is not just with the foods you consume, but the water you consume. All right. Now, a lot of us discount water, but we don't understand if we're 80% water and we're highly acidic, but we want to fix that, that means we need to consume more alkaline. Now, how we consume it is very important. It isn't just the aspect of consumption, simply because our body's design is for breakdown and absorption. All right? Now, our stomach, what do we have in our stomach? What does our stomach do? So it uses the acidity to break down the foods into the enzymes necessary for the spleen to transport and transform that to wherever, and tell the small intestines decide what's good for here and what we need to leave, what needs to get out the body. All right? So it starts in our mouth. Our digestion, our absorption starts in our mouth. Yes, you will read different books that'll say digestion starts in the stomach. That is false. Okay? The stomach has a function and our whole body functions together. All right? And so, the acid in our stomach, we need that acid in our stomach to break down our food. So we don't want to diffuse the acid in our stomach. Now, when we're drinking water, what do people have a tendency of doing when they're drinking water? Gulp, 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 gulp. They gulp it down. You know, they say the American Association of Health says 8 cups of water a day. And people looking like, oh Lord, it's 6 o'clock, I ain't drink water all day. They gulp 8 cups. I have my 8 cups. All right, and what ends up happening when they do that? It comes right out. You got to pee it out. You have to pee it out. Okay? Inconsistency, yes. For the point I'm trying to make, yes. All right, because the point I'm trying to make is we want to utilize our stomach's absorption, but we don't want to diffuse it. If we gulp alkalinity, we diffuse the acidity in our stomach, which causes malabsorption. That's just from gulping. All right? And if you have malabsorption challenges, your body gets confused and says, oh, throw that in the fat cells because we don't know what to do with it. We'll work it out later. You see what I'm saying? Huh? Exactly. It's not, you're like, oh, push that over there on the wall. We can't do that. You're going to have to use the chair. That's technically a table. So in order to not diffuse the stomach's necessities for breaking down, and where does absorption start? In the mouth. This is why we hold our food, our water, our alkaline water. We want to hold it in our mouth. All right? For a minimum of 30 to 40 seconds. All right? Why do we do this? We want to activate our salivatory glands. What's the purpose of our salivatory glands? What do you think? It aids in the breaking down, all right, which means, okay, that it's moist enough going down, all right, mixed with saliva. So we're going to start with that.
The amylase also helps the stomach with hydrochloric.
Very good. It sends signals to the stomach, hey, we got this coming down, you're going to need this to break it down. All right, so this particular acid, amylase comes up. You know, and then they have a different acid that comes up, say, oh, this is why you're breaking down? Okay, we got the acidity for that, to break that down.
What if your stomach has amnesia?
If your stomach has amnesia, then you're in a state of malabsorption. All right, because if we're in a forgetful state, then we forget function. And if we're forgetting function, then we're encouraging dysfunction. All right? So if it's amnesic, we have to remind it, and reminding it comes with intentful expression. Okay? So, where was I? All right, break down stomach acids. We want to infuse. So when we hold it in our mouth, we activate the salivatory glands, which does all those factors that we just mentioned. All right? But what it also does, because our body is built up of what? Cells. All right? And what puts all these cells together is our interstitial fluids, the fluids that flow between our interstitial aspects of our body. Now, when we excite a particular area that is in pain, and we're going to breathe into that pain, all right, by positioning, especially for like this back pain right here, I'm like, okay, I'm feeling it here, so I will take this same leg and turn the toes in, make sure my heel is out, and then I'm going to come and position myself forward, which is going to cause the pain to be excited. All right, but you're straightening here. And in this excitement, you exhale into this position. How many times? 3 times, all right? And so then there's specific movements that's done to help alleviate the challenge, all right? And bring you back into balance, AKA alignment, okay? So it's addressing your own personal alignment, identifying what's high. Oh, if it's this side, this is the side I'm gonna work with. I'm gonna go against the area, exhale into it, making sure that I can have movement with that exhale. And then by holding it in our mouth after breathing how many times?
3 times.
Into said pain,
Into the pain.
right?
And through the pain.
This is when we want to hold our alkaline water in our mouth. All right? Because by activating the salivatory glands, our nourishment of the area that is inflamed or hurt, it's like breaking that police tape and going in and feeding that area. Because when it's in pain, it's constricted. All right? When it's in pain, it's resisting nourishment. And anything that resists nourishment becomes what? Hungry. Hungry. All right? Which means you become hangry. You've all been hangry before, right? So if you're hangry, that means you're mad. You're like, ugh, you're irritable, and you get everybody like, all you want is a hug, but you're like, give me a hug. You know, you see what I'm saying? Because of that frustration, okay? But if you were fed, you're embracing. You're like, oh, hey, hi, come. You know, peace and love, right? Because you're full, you're being fed, right? In the same way with our pain, when it's hangry, it puts up a barrier against nourishment. So the first thing we do is try to nourish that area. How do we nourish it? We apply action, breath, positioning, movement, and hydration. Okay? This is one aspect and a aspect that works with any pain.
Even emotional pain.
Emotional, psychological, physical, it works for all of it. All right? Because the power that we have is not just our passion and our hearts, but how we think. All right? Our thought process shifts whatever it is we want when we put it to work for us with our breath, positioning, movement, and we complement it, reinforce it, and reassure it by hydrating. All right? And when we hydrate, holding that alkaline water in your mouth, all right, it allows a nourishing of this said area that's in pain. So I have for each one of you